Hello everyone, Luca Mazzucchelli here. Today we speak about eating disorder directly from London, King's College. Professor Treasure, thank you very much for your time today.
Thank you very much for inviting me.
For question, is there any suggestion that parents can follow to help child with eating disorder?
Parents play a very big, important role. For a start, they can be the first one to notice that something's wrong, because the individual themselves is often confused and doesn't know what's happening. So for them to notice the problem and get something done about it is very important. And we know that if treatment can be given in a time window within the first 3 years of the illness developing, the chances of recovery are much better.
In your experience of eating disorder, what do you consider as best variables to understand a good outcome?
Well, the best is what I said before, duration of illness. That's persistent, that even with a short illness, if it lasts for a longer time, it is harder. But even if it's gone on for 30 years, the longer, 40 years is even harder. So that's one of the worst problems. So getting in early is very important. But there are other extra symptoms, such as a tendency to be very obsessive and anxious, that can make the prognosis worse.
Which characteristic a psychologist should have to work well with eating disorder?
Well, I think you need to be compassionate and to be very patient, because these patients don't recover very quickly, so it takes time. And it helps if you're quite flexible. So in a way you have to show some of the traits that are a bit opposite of what our patients have, because they can focus a lot on detail and be rather rigid. So we have to do the opposite of that.
Perfect. Thank you very much, Professor Treasure, and see you soon.